Yes, good morning, everybody, and thanks for inviting me. So I'll try to be very brief because I have a lot of slides. So I will be talking about a number of key support mechanisms that we offer as a Belgian medicines agency, as a regulatory body for the support of rare diseases, but also drug repurposing more in general, in fact. And I will also then give some key home messages as well. So as some of you may know, we have indeed set up within the network of agencies a network of innovation offices since a couple of years, also inspired by the European Medicines Agency Regulatory Network Strategy. And we really want to position ourselves as early as onward possible for the developers to really guide them through their whole journey of development, offering a number of tailor-made services. And this is also in a complementary way with EMA colleagues who, and the next speaker will talk about this, like IDF. It's not only about providing early regulatory, scientific and technical advice to developers and academics, but it's also crucial, as we have seen from practice, that we also need to guide them through the whole complex regulatory system, because it's getting more complex after year, in fact. And so we also need to help them guide and raise the right questions at the right forum and the right point in time. This is really crucial. And this is even more of importance when we are talking about drug repurposing, because there often you don't start from scratch, but you need to really do a kind of gap analysis between the data that are out there for current indications and what will you be able to leverage or not, or extrapolate to the new indication that you're looking for. So that being said, one of the first key support mechanisms that we offer, what we call is project info meetings. It's quite similar as the innovation task force meetings offered by EMA, where we really try to give developers, academics, SMEs, an early dialogue platform where they can very informally come and explain what their project is about. And initially we started off targeting innovative methods and medicines, but we have also opened this up to drug repurposing projects, and because we see a vast potential there in this early dialogue, because quite often academics, they do not always know exactly where to start. It was mentioned before, and we need to give them a first level, high level guidance, what type of guidance they might need to look at, what key challenges they will be facing across the project, so that they could really take much better informed decisions also, and together with the funding bodies, because they need to judge then whether or not a certain project might stand a chance for funding. And this is really crucial to really find the criticalities that will really impact their project planning, implementation, etc. So, and this is free of charge, so really very low threshold. And this is really, I think, has demonstrated already its value, at least from our view, to already increase the chances of success and also to generate better outcomes. It's also kind of precursor for the next support mechanism, which is called the formal scientific regulatory advice procedures. Many of you may know more or less the key principles behind. This is not quite often not free of charge, although many agencies also like ours, we do offer fee reductions, fee exemptions, especially like for academics or clinical trial related advices. And this is lowering the bar for them to come to us. Of course, you have to come with very specific questions, and this is already first hurdle for academics, quite often not always knowing what is the real critical question I need to put on the table, and how to formulate this in the best possible way. So, but the outcome we do generate is a kind of formal advice. It's not binding. We also pay a lot of attention to bring in patient experts. This was another pilot project within our agency, which we started 5 years ago, really giving added value by bringing in patient experts, and they also provide additional expertise compared to our scientific experts. Of course, this type of mechanism is prospective in nature. It's similar as for EMA advices, focusing on the development strategies, and it's not really intended to perform a kind of pre-assessment of your dossier. Again, this is already another challenge that we see, because quite often we have seen from practice academics approaching us with a draft IMPD in view of planning a CTA submission and just asking, can you review our draft IMPD, because we do not know what the critical gaps are, in fact. But again, this procedure is not initially designed to do a pre-assessment for a number of reasons. Still, we see a lot of value in this, and especially to try to de-risk the projects, because it's all about de-risking the projects, enhancing the outcomes, and also help them in preparing for the regulatory submissions, not just the trials, but also in view of marketing authorization and then variations. What we have seen from experience is, unfortunately, and especially in drug repurposing, a very low uptake for a variety of reasons. So we need to help them to really enhance this. Of course, we also saw a lot of challenges with COVID-19. We also had, although a very promising experience with the Belgian KCE, which is our HTA body and funding body, joining forces with the academic groups and coming for early regulatory scientific advice. Apart from that, we also had a case that was referred from the STAMP pilot project to the Belgian level, in which we helped forward in a successful way. On top of that, we also have, since a couple of years, expanded and really tried to close the gap between mononational advice and European advice by offering multi-member state advices, where you can really, if you have a consortium of 4 or 5 academics across different member states, you can really join forces with the respective authorities to really come for one single advice meeting on the spot with all the expert teams from the different agencies involved. So this is really increasing a lot the efficiency, the time, the speed, and of course also especially generating more convergent views at the end of the day. These are just some graphs to show you. We see a lot of potential on the one side because we have handled over 150 devices across the last years, but we see at the right side an extremely big gap because academia is completely lagging behind, and this is something we now need to look into. What are the key barriers that really prevents them from using this mechanism, because it's really an extremely helpful tool. On top of that, we have already started in an EU-funded project with all 27 member states. This is quite unique in the so-called IncreaseNet project, where we are going to develop this year and next year a kind of platform where we could interact between let's say the funding bodies, the regulators, and the academic researchers, because this is a clear missing link. You have connections between the first 2 players. You have a little bit less connections or interactions taking place today with the authorities, and you have actually virtually very, very little interactions, at least today, between the funders and the agency. So this is really something we need to close the gap and really increase the efficiency of the whole European system. That being said, we have run a pilot within the so-called Attract funding call recently, thanks to the collaboration with some funding bodies, where we really step in the first stage, the pre-grant stage, to really help give early advice so that the academics can really take that input on board and redraft their proposal so that it would really become much more effective and much more, let's say, prone to getting the grant from the funding bodies. And so this pilot, as I just mentioned, we started last year with a consortium of 7 funders across 4 different member states, which are funding large-stage oncology trials with also quite a number of drug repurposing candidates in that respect. The first results that are coming out are very promising because we not only give advice to improve the quality of the proposal, but also and more particularly on the study design, the overall development plan, and especially in view of will they be able to reach a future product label extension. So this is really very important, and to give this input via the scientific committees of the funders to the academics. So it's working in that way, in fact. We mainly focus on, let's say, the key hurdles, the red flags, as we call them, not on the minor issues, because we need to really be very precise and effective. The procedures are also quite limited at time, so we need to focus on the key elements that are potential blocking factors to really create a successful project, and that the funders could fund with more, let's say, on a better informed, let's say, basis. And so basically within that call, we managed, together with the colleagues of the Dutch Medicines Agency, each taking 3 scientific advices on board based on a number of pre-selected proposals. And so we have concluded in the first stage of the evaluation round, we have included those advices. And so next Monday, we will have our kind of first feedback meeting with the funders, but at least what we already captured was that this type of input early on is extremely useful to help reshape the project proposal, so that in the second stage, the funders can really see if the recommendations have been taken up, if the project is much more likely to succeed from the regulatory kind of compliance perspective. And this is really the way forward in my personal view. So just to close, some key takeaway home messages for you. First of all, I think it's incredibly important that you reach out to the regulators as early as possible, because there you can really make a difference. We see many cases coming way too late when everything is said and done, or already doomed to fail, to put it a bit blunt. Enhanced collaborationship, as I said, between funders, regulators is certainly the way forward. Yeah, some aspects have already been talked. I think also what I do see as potential is really the joint scientific HTA advices, so which were already possible under the current EU regulation. Now with the HTA regulation, you will have the joint scientific consultations. Again, with a lot of maybe hurdles also for academia, but this is something we should look into because you really want to know early in advance, not just to see if you would be able to reach a marketing authorization or a variation, but also what the payers and what the reimbursement authorities will think about the new indication that you are heading for. Of course, also we're exploring other pathways. Some of them have already been touched upon yesterday in some sessions. Is absolutely key because, yeah, at the end of the day, the market access, this is one of the key criticalities, the key critical gaps still to close. Also, as I said, yeah, collaborationship, I think we heard it a lot already in the previous days, is more than ever crucial. In a network approach, you can really achieve much more, not just networking between, let's say, the funders, but also across the different players is key. Also working more on a broader maybe definition for repurposing, because also sometimes I feel that there's a lack of focus also on repurposing from, let's say, the different indications, but also towards different populations, from elderly to pediatrics to other populations under that has maybe been neglected. This or repurposing in other types of formulations may also be in itself innovative. So this is something we could also explore. And last but not least, as I was mentioned before, the seamless funding body mechanism, this is also, I think, in my view, in conjunction with the regulatory way of working, the way forward. So I'll stop here and take any questions. Thank you very much.